what we've been hearing, that only is essential riders only, but it's nice to see the mix that we have here. So with that, I will officially welcome everyone to TRU's virtual town hall on safe transit during COVID. As we all know, COVID really upended everything in this region across the country. Few things more than transit. There was literally a drop of 70% in ridership in a week or two. New safety procedures are needed. There was very little consistent information from federal agencies. And yet, essential workers, the people that we have all been depending on over the last few months, we all depend to keep our society rolling. Well, they still need to get to work. And nationally, fully 36% of transit riders are essential workers. So in order to make sure, really it was transit that kept our whole society rolling. So despite some media fear-mongering, there's actually been very little evidence showing that transit is a particularly major spreader of coronavirus. So we're here to talk today about what did the transit agencies in the Detroit area do to when coronavirus struck, how were riders impacted, and what's next. So we will discuss all of that and more over the next hour or a little over an hour. So I will, at this point, to start things off, because I know we've got a wide variety of people. I see some names I recognize and some I don't. I will introduce Donald Stuckey, who is TRU's board president, to share a little bit about TRU and what we've been doing before we move to our speakers. Donald?
Thank you, Megan, and thank you for everyone who is joining us on Zoom and on Facebook Live. On behalf of myself and the board and the staff, I would like to welcome all of you to this virtual town hall. TRU is a nonprofit organization which has been working since 1999 for almost 20 years in Greater Detroit to improve public transit. We do that through educating the public about the importance of investment in transit, advocating for elected officials to improve public transit, and engaging people in decision-based making process around transit. So, and this is done through education, engagement, and advocacy. TRU has been busy over the past few months. We expected to focus this year on a 2020 regional ballot measure, but obviously since COVID, we have been working to make sure that transit is available and making sure that people understood what's been going on. TRU has been fighting for funding. We spoke out and mobilized to secure $25 billion in CARES Act funding. We've made testimonies before City Council about funding for transit. We have educated we've educated the public about transit services, whether this has been through bus changes, bus service changes, and rules that have been put in place. TRU has been advocating for bus improvements, pushing for improved meetings, meeting with officials. TRU has developed transit during COVID report and recommendations, and we've built public support for transit investment. And I would like to thank all of our transit workers, those who work for DDOT, those who work for SMART, those who have been involved in any of the transit services. We want to thank you for putting yourself at risk to serve the public during these difficult times. Now, as for that, now you can see that the work that TRU has been doing is very important. We want to ask you to join TRU as a member. And You can give a gift at any level. Many people give at the $25 level, but you can give at any level. You can give whatever you're comfortable with. So we want to thank all of our members who have been supportive in giving a donation to True, and we hope that you will continue to support the hard work that we're doing. Our staff is making every effort to educate the public and to advocate for public transit. And so we know that if you check the chat box on Zoom or on Facebook, there's a link being placed down there where you can click that button and make a donation. And don't forget that if you're watching this on Facebook now, go ahead and smash that like button so that you can follow True on Facebook. So with that, I'm going to turn it back over to Megan. And thank you so much for joining us and to all of our guests.
Thank you so much, Donald. So as Donald briefly mentioned, one of the things that we've been doing is trying to understand what has the impact been of the coronavirus on transit during this time. We've been analyzing things both nationally and locally and are putting together a report to help understand what happened and where do we go from here. One of the most dramatic, as I said, what happened here was the same thing that happened across the country and across the world. Within a few weeks, transit ridership dropped from its normal, from roughly normal levels in February down to 50, 60, 70% cuts. There are some transit services, especially things like commuter rail lines, that have actually dropped 95, 97%. Especially when you have more choice riders. Detroit dropped a little less than some cities, perhaps because we have a lot of essential workers who are riding. We got this data from Transit app, and they interviewed 250,000 people from across the country who use Transit app to find their ride, and they found, well, who's still riding? It is those essential workers. It's people in food service. It's in people in healthcare and healthcare support, in maintenance. Really, as I mentioned earlier, transit is enabling all of those essential workers that we're depending on to get to work. And what has been interesting is to see across the country, it has been actually more people of color, more low-income workers than even you traditionally get. So we've looked at what have transit agencies all across the country been doing in response to COVID. What are the best practices or the most common practices, and found a couple of common areas. One is, of course, figuring out how to make riding as safe as possible. Trying to figure out how to provide sufficient social distancing, even though you're in a small space, figuring out ways to alternate seats if possible, trying to reduce capacities. One of the steps that SMART and DDOT took very early was to have people load from the rear door to give some distance from the driver. And certainly it seems like one of the key steps has been making masks a critical component of riding transit. And especially, and again, DDOT has actually been handing out masks to tens of thousands of riders, I think, at this point. Sanitation, obviously, buses are always getting cleaned regularly, but increasing the frequency of cleaning. There have been some agencies have been piloting new different ways. I can't necessarily tell you what electrostatic fogging is, but it seems like there's some new technologies and new ways to try to make transit as clean as possible. And one of the more challenging pieces has been service changes. When ridership drops dramatically, a lot of agencies have trimmed the amount of service that they've been providing. But if it's trimmed too far, then you end up with crowded buses, and that undermines the efforts for for social distancing. So this is just one example from our friends in Indianapolis of the changes that they made as their service adjusted. And then certainly communications. It's challenging to get information out to transit riders under normal circumstances because of the incredible diversity of people you have. But it seems like a lot of agencies have been working to both put signage at bus stops at transit centers, as well as to use online means like their websites and their social media to continually get the message out that of steps that can be done to make transit as safe as possible. Those are a snapshot of the things that we've seen all across the country. But I know what people are especially interested in is what's been happening here. So I'm going to next turn it over to our transit agency leaders. I should mention again, if you have questions, definitely jot them in the Q&A. We will absolutely be taking questions afterwards and after they each present, and we will also open it up to additional speakers at that point. So we will get started first with Robert Kramer, who is the Deputy General Manager of SMART. Now, Robert, did you have a PowerPoint you wanted to share? Robert, are you able to screen share? Okay, excellent.
All right. Well, thanks, Megan. I think that was a great introduction that really set the stage. One of the things that's kind of very interesting to me, the rear door boarding idea, and I got to give credit where credit is due. We were having a meeting where we had all of our driver union folks that were kind of getting together probably middle of March, when we knew that something was going to have to be done quickly. So we wanted to get everyone in the room so that there was no surprises. And, there was one of the union stewards in particular said, what's really making us very nervous is how many people are at the fare box. Could we move the fare box? Could we have people, not use it? Could we have people come in the back door? I said, crazy times call for things you would never think of before. And, we did it 2 days later. And the crazy part is how many other places did it as well. There was no directive state or national level, but I think there's a lot of really good people in transit that kind of just are good at figuring things out. And, it's just small steps like that again, kind of seem strange, but make a lot of sense. So anyway, I'll try to keep it brief here. Our internal response at SMART has varied, touched a lot of different places. Obviously, we're kind of 4 months into this, so some things had to be done very quickly with very little information. As you learn more, obviously, you can make adjustments. We did have a very early adoption of the rear door boarding, shutting off the fare boxes. Our HR department has been fantastic, really staying on the cutting edge of best practices right from the beginning, as far as tracking and reporting cases, doing the case tracing, having other people quarantine who came in contact. That feels kind of like second nature, but when we first started doing it, it was kind of novel at the time. So we've been really good about that throughout and tracking those numbers. We've got over 100 of our staff that are working remotely, some or all of the time. So our internal mantra is basically we're maximizing remote work. So if there are things you have to do that require you to come in to do them, plan your trips to make them as few as possible. And then just making sure that at the terminal and on the buses, obviously the vast majority of transit workers have to be either at the terminal or driving the bus because of the business, of course, that we're in. So just making sure that everyone is really clear on all the information. We've been having weekly webinar updates for our different groups of staff internally and using Zoom, which is why I have so many interesting backgrounds of the carefully curated collection, just to keep everyone kind of on the same page about what's going on. We've been adding, we've added obviously additional sanitization services. We've done the mysterious fogging, which is basically the particles are charged so they kind of cling to the surfaces. And that's really been something that we've been doing on the buses and in our terminal areas, which I think offers a peace of mind, but also really does do a good job of kind of giving a clean slate and actively trying to kill the virus organisms just to prevent that spread. We've got the playbook, which I'll touch for about 10 seconds here on the next slide. And then obviously we've got the CARES Act funding, a whole suite of projects and funding assistance that we've been using there, including a couple of projects I'll talk about here in a few slides. But really it has helped us not have to worry, in the short term at least. You know, the right decision was to turn off the fare boxes to keep people safe. This helps give us a little bit of a cushion between that and the big drop in ridership to make sure that we can still keep our doors open and our lights on to get people where they need to go. So briefly, we do have a playbook. It's on our website. We have a kind of a page that's dedicated to COVID-19 updates, whether it's service, policies, whatever it might be. So the latest version is always going to be available there. It's really intended to be a public playbook. It's not establishing any new policies, but it does have a nice summary of kind of all the things that we're doing, kind of who's accountable at each one of our locations or each one of our units to make sure that we're keeping on top of things like having the PPE supplies in place, making sure that policies are communicated effectively, that the health screenings and everything are being followed through on. We had a little video that helped do that internally. But this has been not only a public document that can really help provide some information and hopefully some comfort to the riding public, but also it's something, again, for our employees to better understand kind of their role and what we're doing to keep everybody safe. Now, when it comes to safety, I mentioned the buses and the facilities are treated. We follow DDOT's lead as far as having some crews out on the road to clean buses at some of our major layover or turnaround locations, which we hadn't done before, just to, again, get another set of hands, another set of rags, so to speak, to touch the buses as much as possible. For all of our staff and any vendor or visitor to the terminal, they have to complete a daily health screening questionnaire and have their temperature taken. And for our paratransit passengers who have to schedule their trips over the phone in advance, they also go through the same screening questionnaire. That we don't take their temperature when they get on the bus, but they are supposed to report if they have a fever or other symptoms before we will schedule and provide their trip. And then we've got contact tracing. Again, the staff has testing. We're tracing. If we have a driver, for example, who may have gotten it, we'll go back and kind of see which buses that they were driving on. We've had very few instances of that happening, but it is something we have in place mostly internally just to make sure that we're keeping everyone safe. And all of our staff are required to wear masks at all times when they're working. Obviously, remote working, they don't have to. But when they're at the terminal or on the bus, they have to wear it with a very specific few exceptions. Now, we've also obviously continued our fare-free operation. The driver shields are in progress. So our paratransit vehicles all have a temporary plexiglass shield. We are in the process this week and moving into next week, we'll be in full force installing temporary sneeze shields, we're calling them, on the fixed route buses as well. Longer term, I'll talk about in 2 slides here, our longer term plans for more permanent solution. On the fixed route buses, masks and distancing, the masks are required. We don't have a hard capacity number, but really just strongly encouraging people to distance as much as possible. And I mentioned on paratransit, we do have the health screenings, and because we're scheduling all those trips, we are able to limit the number of people on the bus. In that case, it's 6 people or fewer, but most trips are actually more like 2 or 3. Really quickly, our version of Megan's slides here, this is our paratransit ridership. You can see has started to creep up here. There's a little bit of a delay with the data, but middle of June, as we kind of moved into phase 4, we're starting to see those numbers creep up. This is the fixed route version, which is a little more complicated. So the green is our regular 100% ridership. You can see early March, late February, we were tracking at anywhere from even to maybe 20% over our year previous ridership. And you can see very quickly before the stay-at-home orders in place, any of that happened, the ridership did go down to almost an 80% decline very quickly over the course of basically a week. The blue line is what our service level has been along the way. So that's kind of, you can see we've dropped it by 30%, then by 65, and then by 70. And then when the state moved to phase 4 on June 8th, we doubled the service we had in place to get up to kind of a 60% level of service. But that's not equal across the board. We've got some routes that are turned off, others that have much more than 60% based on where we're seeing the ridership. So last couple of slides just to kind of say where we're going here. So right now, obviously, we've got the temporary shields. We're looking at the short and long-term fare solutions. The commuter routes right now are all suspended, so that'd be any route that goes in and out of downtown Detroit in the morning and afternoon weekdays. Those are all turned off. We're watching very carefully to see what the demand for those trips might be, but even places that are having people come back are having them do it on a very limited basis. So we were doing over 1,000 rides every day on our commuter routes beforehand. And right now we do have a reservation-based system available where you can schedule a trip on a small bus, and we have about 20 people that are using that across our whole system. So right now that demand is very low. Our fast routes are still running downtown on basically a regular schedule. In the midterm here, we're looking at these quantum automated wheelchair restraint systems. This is some place where our drivers do have to come in close contact with people to follow ADA regulations and properly secure wheelchairs. These systems probably are about 4 to 6 months out, as are our permanent driver barriers. An example is here on the screen. And then again, the fare methods are kind of working on. We're also using our CARE dollars to upgrade, so to speak, about 25 buses that we were going to be ordering this year now will be articulated 60-foot buses rather than 40-foot buses, to give us a little bit more flexibility for a number of reasons. If we're short on drivers, or if we want to have more spacing on the buses, those would be great. We're hoping that we may actually be able to get those on the road in February, which is a pretty quick turnaround for fixed route buses. Last slide is just kind of the longer term. Fares will be restored when safe. This is something that we're in lockstep with DDOT, and Michael is really, we're going to be working very closely on that to make sure that there's no confusion, that it's a smooth and safe process. We'll consider the commuter routes will be restored as demand warrants. The Smart Path Plan, which we had our board approve in April, initially we were going to implement a lot of stuff in September. We may implement some things in September, but it probably will be early next year. We're also going to be piloting microtransit services starting hopefully in January. That's what these maps are. These are the zones we're considering. And then we've also, our board's going to be approving a contract for the first phase of our Mobility Hubs project, which is going to be starting phase 1 next month. It's basically a process to design and study some souped up park and ride lots, one location probably along each of the 3 fast corridors that will not only be a park and ride lot, but will kind of be a space that we own that can have anything and everything out there that's helpful for mobility solutions, transfer points, bike share, ride sharing connection area. We were half joking last week saying maybe we could put Amazon lockers there, bike lockers, whatever it'll be. They'll really be kind of like an incubator for whatever electric car charging, whatever it might be that we can use there. So I'm really excited about that project that will kind of be part of the next phase of SMART as well. So I'm going to stop sharing my screen. I don't want to take up too much time, but that's kind of an update on where SMART stands right now.
That's great. Thank you so much. Some great information about both how you handled as when COVID hit and what's coming up next. So we are going to hold questions. We got a couple questions coming in. Again, if people have questions, put them in the Q&A. But we're going to hold that until after we hear from Detroit's brand new Executive Director of Transit, Michael Oglesby. Still working on that pronunciation. Did I get the title right?
Yes, you did.
Excellent. Well, thank you so much for joining us. And you don't have a PowerPoint, that's correct?
That is correct. You know,
Okay.
I talked to Robert. He didn't tell me anything about a PowerPoint. You know, it's tricky. You know, I don't know. I just come here. And I guess I was told I was just going to come and say hello and leave, but I guess not. I'll just have to go over some of this stuff. But
no, that's great.
I can talk to it all.
That's great.
Yeah. So you want me to start now?
Yeah, please do go ahead.
Okay, great. Well, it's a pleasure to be here. This is really exciting to be here in Detroit to help bring us to the next level. There's a lot of great opportunity. I love Detroit. I think this is great, and I really love the opportunities that we have here. You know, a lot of the things that were mentioned before, even Megan, when you were going over your PowerPoint, you were mentioning a lot of things that also Robert had mentioned, which is clear that we're on the right track. We're basically doing what a lot of places are doing, and we're trying to get as innovative as possible. But I'll tell you what, I've been in transit 20 years, and there is no way that I've picked up how to deal with a pandemic. Okay, so I have no problem saying, you know, this is new to all of us and we're learning, but we do care about the riders. We care about the drivers. A little bit about me, since I'm new and a lot of people may not know this. My father drove a bus for 34 years, so I'm the son of a bus driver, and I'm proud of it. And I say that all the time because I respect what it takes to provide public transportation, just in general. Forget about the pandemic for a second, just in general, and then with us dealing with what we're dealing with. So when this whole thing hit, DDOT made the decision to reduce the schedule to a Saturday schedule. I think at the time, the thought was, we put it at a Saturday schedule, that'll be plenty of transportation. Well, guess what? People from Detroit still travel on public transportation in droves. So I think we were kind of, I'd say honestly, taken by surprise a little bit, because where we normally have about, I'd say 60,000 riders a day, it dropped, but we were still getting 20 to 23. And with that type of a schedule, you still have overcrowding, right? So the first question is, well, you're a transit system. You knew, so why don't you put more vehicles on? It's a pandemic. Well, I wish it was that easy, right? Hindsight's 2020, but here we are. So we learned a lot, but I mean, our buses were crowded. The second I came on board, I was just bombarded with complaints of crowded buses. What are you going to do about it? The great thing is that DDOT jumped right out and started boarding from the rear like everybody else. But more importantly, started handing out PPEs, which a lot of places weren't doing. We were handing out masks immediately, encouraging that you wear a mask when you're on the bus. You can encourage, we couldn't make it mandatory because the layout that was for all of Detroit was at the time, masks were encouraged to be worn, right? And if you're going to make them mandatory in a public system, then you have to have a policy and everything in place. It's hard to kick people off a bus, and that gets a little messy. I've seen that we've all seen the YouTube videos, right, that have went viral. We don't want to be there. So, we did the right thing, but we immediately put safety procedures into place. Not only at our terminals, but on our buses, and we never really stopped working when it comes down to it. So though our administrative staff was at home, we still kept going, and we had to do everything from testing daily. We had the social distancing piece and everything that we knew at the time, but we had a full layout, and we still go by it today because clearly safety's first. So we focused on the safety aspect of it. The other thing that was taking place was, at the time, we went, I think, with probably about a 60 to 68% schedule. Still wasn't enough. And at the time, SMART had immediately reduced. At the very beginning, there was an immediate reduction, which made some of our routes even more crowded. So now we have less. It was a challenge, to say the least. But that's just the way it is, right? So we march forward. So a lot of people say, well, what do you do in that situation? So what we really had to do was we had to get creative, and we started sort of, if you will, robbing Peter to pay Paul. We were taking buses from various routes and extra board and just plugging them where we could. That wasn't necessarily working that great. And trust me, the public let me know. So even though I was here a week, I might as well have been here for about 5 months, because folks were saying, look, we're not having it, fix it. So what we ended up doing is we went back to the drawing board, and we went to a Saturday schedule, but we enhanced a weekday schedule on all of our high ridership routes. So we took a look at that. That has been working, but the problem is when you take from one and give to the other, you have less complaints in one area and more complaints in some of the lower ridership areas. So we're, again, working on scheduling. It's a moving target. We have to just keep focusing on these things to figure out how to get this right. And we just keep working hard. From a cleanliness standpoint, I'm going to have to say, I've been told that our buses are cleaner than they've ever been. And I hope so, with the amount of money that we're putting into them. We have increased the cleaning. I have here working 24 hours, 7 days a week, 3 shifts at 8 different locations with 2 workers per shift. Not only that, but the cost includes supplies, materials, and only 1 rag can be used per bus. I mean, that's where we're at this point, right? 1 rag, put it down. And trust me, if they use 2, drivers will let us know, and they have. So there are no shortcuts here. We're making sure that things are clean. We do that at various locations: Rosa Parks Transit Center, Michigan, Woodward, Gratiot, Jefferson, St. John's Hospital, Fairlane Town Center, and Northland Mall. We're just constantly, I'm telling you, we're cleaning these things so much, I think we're rubbing the paint off them. I can't lie to you, but I think where the goal is to keep things safe and clean. Now, the other question, because I might as well just start going into more of the detail of what some of the issues are versus what was done, because they're similar to what Robert had mentioned. You know, we worked really hard on making sure that the drivers were safe, because we need, you know, we had some issues there and we wanted to make sure of that. But in doing so, it ended up taking away a lot of space on the bus. So, you know, if you go 10 feet back and you cut off that space, yes, the driver's safe, but now we're boarding from the rear. We want to make sure the riders are safe. The only way to do that is to do social distancing, staggering the seats, which only allows 10 people per bus, which you normally have 40 people per bus. So really think about that for a second. If you pull up and there are 20 people out there and a bus pulls off and it looks half empty, that's really not great optics. And people say, why couldn't I get on? There are some other buses that are just packed because people aren't going to wait. So the one thing that we did, and Robert mentioned it, we have our road supervisors out there. Basically, we opened up the eyes and ears to have an idea of where the crowded locations would be. So we have our road supes out there, really looking at the crowded routes. We have a lot of communication between the driver and dispatch, and we make sure that we all speak to find out what's going on, to make the decisions, to figure out where we should put additional buses. Another thing that we're doing is we're looking at our passenger counter numbers, which basically tell where overcrowding takes place per bus stop. And looking at that beforehand, it's really glaring, the hours and the times and the locations. So that's helped us also. So when we put all that together, that's what we're doing when we're putting one bus here and one bus there. It's not just, hey, it seems like it's crowded, make the decision. There is a method to the madness. So we clean the buses at the end of each line, and then the level that I had mentioned to you. We provide free rides. Of course, because we don't have the fare box up and running yet, and we don't have a date as to when we're going to lift that. But to tell you honestly, with this pandemic and what's going on, and Robert and I have this discussion, that's the furthest thing from my mind right now. Collecting fare is not what we're thinking about. If we could continue to do this, we will. The CARES Act money will only last so far, though, and eventually we'll have to figure a way to collect fares in a safe manner. The barriers is one. We have to come up with some type of solution from a fare collection standpoint. If people are touching the fare box as they enter constantly, how are you going to clean it? Who's going to clean it? Drivers are union employees. They're not going to clean it. Do I have a maintenance person on that cleans it? Well, that's not a good resource. So these things come into play, and then we start looking at all of the fancy technology that's out there. But then, do you have, you know, how are you going to offset that? What if you don't have a cell phone? It goes on and on. So we're really looking at all of these elements to try to find out what we're going to do with the fare box issue. Entering from the rear, we're going to continue to do that until we get a barrier up. There was a barrier mentioned, sneeze guard, driver barrier, whichever one you want to call it. I think it's very important that we really focus on this, and I started pushing for this the first day that I was here. And I think we're moving in the right direction. We've already put everything out on the street. I know Robert's in the process of doing it too. We're going through the process. I don't necessarily like going through the process. I would rather do like an emergency purchases to get these things. I've been screaming up and down. But I will tell you that once they come, they're going to be in place. And then we'll decide what's going to happen to the fare box. Because just because we have those installed does not mean we're going to charge fares. There's a lot that comes into play. And again, we have masks on the bus. We plead people, if there's anyone out there that gets on the bus and you need a mask, take one. If you need gloves, take one. I won't get into too much detail, but there are some that are taking the box. And then when I go to the local store, I see my own box there being sold to me for $1. So I want to make sure that we respect what we're trying to do, and we'll respect you. I think that's the best thing. We continue to put the boxes on there, and that old adage, if you see something, say something. If you see someone grabbing more than one, say something to them. How's that? As far as service updates, so what we did is we took a look at, what was happening, and I mentioned it earlier, but what we realized was Grand River, Woodward, Gratiot, 7 Mile, Warren, and Greenfield, which is our Connect 10, some of our Connect 10 routes, were packed. I mean, they were so crowded. So what we did is we ended up doubling the frequency during peak hours. That's the first go round to kind of see if that offsets it, and that has been working. But now I'm starting to get complaints about off-peak hours, right? So we can only do so much with the resources that we have. Another challenge that we have, and it is what it is just getting enough drivers. I know Robert has the issue. I know I have the issue. But I think that if we can get these barriers up, and we're cleaning these buses the way that we're cleaning them, it is one of the safest modes of transportation from a cleanliness standpoint. And people need jobs. I'm hoping that they say, you know what? I need a job. They've cleaned everything up. Let me give it a shot. So we're really hoping that people take a look at and respect and understand what we're trying to do. We're not only trying to help the rider, but we're also trying to help people get jobs. And I think that's very important. So I think with all of that, when you put it together, that's our goal and our ultimate mission as we move forward. As far as what's next for Detroit or for DDOT, I have a vision. It's big, probably a lot bigger than I should be looking at right now, given this COVID situation. But honestly, I think I want to focus right now on the core transit system and the core that we have in place and the layout that we have. We just don't have enough drivers right now to be able to provide full capacity. I need 477 drivers. I can average anywhere from 260 to 280 to 300 at certain periods of time, simply because everything that goes with it, FMLA, people being out, so on and so forth. But the numbers are really big. And recently with COVID, and COVID has hit some folks and the whole pandemic, we're pretty low. We're down. So we have enough to be able to run our weekend service, but or our modified service, but we need to push on getting more drivers, because when this goes to our new normal, I'll call it the new normal, won't be normal, we're going to call it new, all right? People are going to get out and need more service, and I need to be ready. So we're working on that right now. So the one good thing that's coming out of this is we're pushing to amp up transit to stop overcrowding now and in the future of transit. So my focus, my immediate focus is on that. We get more drivers. We have more of an opportunity to provide better service once we get that solid. Then we start looking at expansion and start looking at comprehensive operations and that operational analysis and things like that to really take a look at the routes and list. And by doing that, by the way, I've done one before. You go out and you listen to the people. Okay, so I can have as many pencil pushers as you want in front of me telling me how the system should be run, and I'll listen to them, but I listen to the voice of the people. And the people say this is what is needed, then we need to incorporate that information in and make that happen. So eventually we'll get there. Right now, this pandemic, we need to get through this peak. And once we get through the peak, that's where we need to go, which is really enhancing service and bringing DDOT to the level that we know it can be. So I won't go on. I think I covered everything you wanted. Talked about to ensure bus safety and how we responded. So I think that was it on your 3 bullet points that you had sent me.
Excellent. Thank you so much. Thank you so much. And for having only been on for a short time, you've got a lot crammed in there, huh?
Oh, yeah.
So at this point, we want to open it up to question and answer. We've already got a number of questions that have come in. But certainly As people who are on the line have questions, feel free to press the raise hand button or *9 so that if you're on the phone, so that we know that you are interested in asking a question. What of the questions that came in is, what are the long-term impacts of budget and service levels due to COVID? Lots of agencies are facing shortfalls and proposing service cuts. How will SMART and DDOT avoid permanent damage from this crisis?
Whoa.
You thought we were going to start easy.
Yeah. Welcome to Detroit. So, yeah, that's really a good question. And I actually ask that question myself on a regular basis. Right now, the way that CARES Act funding is being used by us, instead of using it for some other bells and whistles that we may not really need, where we're putting it into, keeping us afloat moving forward. And I think we're in pretty good shape for about a year or so. Hopefully by then we'll have the revenues. Really, it's offsetting the revenues for us. If we can offset the revenues and get the revenues close to back to normal, I think the damage will be minimal. I'm still pushing on advancement and improvement, and that requires just more resources. It's either one or two things. Either we run something better that's smaller, or we run something, and when I say smaller, to looking at various routes that don't have high ridership and reducing them and taking those resources and putting them into the core, or we do what we're doing now, which is plan on everything's going to be all right, and we are pushing to make sure that we're not giving up. We're not. We're going to keep pushing and keep trying to advance. So we're not sure what the long-term effect is going to be. We've looked at the projections, our projections, and they look pretty good based on the fact that we're able to catapult out a little bit utilizing the CARES Act funds. So instead of saying I have $64 million and I'm going to use it on all these things, I say we got $64 million and I have 27 to use, because the rest is kind of helping us out in the future. And hopefully by then we'll be able to make some decisions.
And that's helping DDOT out into the future. That's not dollars going into elsewhere in the city's budget.
That's DDOT. That's correct.
Okay, excellent. Any thoughts on that, Rob?
Yeah, just it's interesting. I've had like Michael, it's kind of something you think about a lot. This must have been the reason why we've used property tax to fund transit. We thought that this might happen one day. It turns out that not relying on a sales tax or other revenues, in this case, does provide a little bit of stability, at a minimum, a little bit of a buffer, just because of how property taxes are collected. So I think that we are in a pretty comfortable spot, similar to DDOT, really looking at the CARES money was a really nice boost to get us through a 12 to 18 month period that gives us, that we don't have to be, kind of planning for our demise. We know that that's there to kind of get us through any bumps we may experience when it comes to, fare box revenue and or state revenue. And I think really what that allows, and something that Mikkel really said that rings true to me, is it allows us to make sure that we can be there for people that need us now, do it safely, but also be part of the recovery. That's how I keep thinking of our next phase is kind of like, we want SMART, and I'm sure DDOT is in the same boat, to be part of the recovery, getting people back to work. SMART, even more than DDOT, is like 75% of our riders are getting to work just because of the kind of system that we are. And so we know that having that system be there is going to be really critical to helping people get back on their feet when this starts to cool off a little bit. So we're in a pretty good position, kind of like for DDOT, with these dollars to kind of help us make sure that there aren't any real big bumps along the road, at least for the next 12 to maybe even 18 months. But who knows, what will happen here in the short and midterm.
Yes, and great, Robert, thank you. And if I can add to that, based on Megan's question, I want to provide some clarity so it's very clear. $64 million of CARES Act funding went to DDOT. For some reason, there was another set of CARES Act funding that went to the city. A separate $64 million went to DDOT. For some reason, I get the question over and over again, well, yeah, it went to you, but the city used it for X, Y. Okay, well, you know more than I do. I know that we got the 64 million. As a matter of fact, when we went to city council, they asked specifically for the breakdown. I don't have it in front of me, but there was a breakdown of how the funding was being used for DOT only, and then it was approved. So I just wanted to put that out there for clarity.
Thank you for clarifying that. That was definitely a concern. And I mean, certainly one of the challenges with running a agency that's within a city is that some of these things are outside of your direct control. One of the questions that came in was, is City Hall giving you more autonomy, Mr. Oglesby, in the hiring process than in the past? What are you doing to get more drivers? It sounds like that having enough drivers is the biggest challenge, and it's not just COVID, it has been a long-term issue. So do you have more autonomy either through with labor relations or HR or others in the city to do what you need to do to get the drivers you need?
I'm going to say the answer to that question is yes, but it's still such a big challenge. I'll give you a prime example. During the short time that I've been here, I put out that we need drivers. We ended up with, I believe, 20 drivers. I mean, I need 100 drivers, but 20, I'll take anything at this point. So we get the 20 drivers. By the time they go through the process of the 20, I may get 10 when it's all said and done. They drop out of the process. This happens, that happens. And then we bring them on board and we get them going. There was one batch that we had, I got down to 10, and then 2 of them ended up having COVID. And then I had to put them all out on 14-day quarantine. And then when I brought them back, my trainers, 2 of them got COVID. I mean, it was like, wow, this has nothing to do with City Hall, I'll tell you that. It's just like bad luck, maybe. But no, yeah, I have the green light to move forward with them. As a matter of fact, just recently I put in for an open rec. So instead of putting in for 20 at a time, I just said I just need 200, and let's just open this up and keep it going. So no, as far as bringing them on board, everything's fine. The problem is getting drivers. I'm sure Robert will tell you the same thing. It's just hard to get. Now, the other thing that's tricky for me is that I think one of the reasons in the past to try to justify getting drivers on board, and there may have been some roadblocks there. I don't know. I wasn't here, so I can't tell you the full history. You guys probably know better than I do. But I did see that we do have a lot of drivers on the books, but we don't have as many available to drive. That's one thing that I'm really looking at and looking into to figure out, what's really the number, right? Because you have some on FM. There are different topics, right? There's FMLA, FMLA plus. Okay, I got it. But, how many is that? So recently I started looking into that, and I have a whole team now taking a look at this to see how many are we paying for versus how many we have. We're covering a lot of our work with overtime, so that's why you don't see it. As the rider, you don't see it as much. But from a financial standpoint, it's not fiscally sound, and it's something that's been going on for years that I need to look at. So yes, there has been like kind of that old, I call it the old overtime 1-2 skidoo. I'm going to try to see what I can do about what's really going on there. So in a short period of time, I've been digging in exactly to the way that you're mentioning, and I love it when I'm at open sessions and they start talking about things that I'm already working on behind the scenes, and I'm like, okay, this is good. I'm on to something here. So that's good.
Absolutely. Another question that came in, you guys have both made it clear that you're not going to start charging fares until after you have the sneeze guards. I like that name. It's a little less barrier, seems like keep them away, but until there's some sort of barrier or sneeze guard surrounding the drivers, and I know that there is a long delay because there's so much demand. Do you have any sense as to can you give people an idea? Is that a month or two? Is that 6 months? And once that's in place, actually, let's see, Rochelle from Detroit People's Platform asked if you can make sure to give riders at least a few weeks notice so they can get prepared, because a lot of people have been using funds for essential items.
Oh, okay, I'm gonna let Robert handle this because he has that look on his face like he really wants to speak. So my first thing is yes, of course we'll give plenty of lead time, and I think it'll be more than weeks. And then my other answer would be no. Okay, Robert, hit it.
Yeah, I was just going to say, you know, we're working on maybe some temporary ones. Certainly, the more permanent versions are probably months into the future. But even if we have shields in place, you know, that could solve part of the challenge that Mikkel mentioned as far as kind of losing that front half of the bus almost from having to keep people away. But there are still some other challenges to making sure that we can have fare collection happen safely. Those are not some sort of silver bullet that have like a force field around them that keeps COVID away from the whole area. You still have a piece of equipment that people are touching every time that they get on the bus. So there's some other challenges that are there. And I would say, yes, definitely, you know, we had our year anniversary of DART, which was kind of the most official combined fare system that we've had. And so really, we will make sure that there is 100% coordination and a lot of advance notice so everyone knows what's going on, what the safety measures that are in place. There's a question about have we looked at touchless fare collection. Our current equipment won't let that, but there are maybe things we could add on. Whatever we do, though, we're going to do it in concert together because we know people are using both of our systems almost interchangeably, which is how it should be.
Yes.
Excellent. So one of the other questions that I've been hearing a lot about is at what point do you expect to be back to full service? I know you guys are both at a limited service, and I know some of that are things you've talked about, dependent on how many drivers you can get back. Do you have any benchmarks as to how you'll be deciding that, or certainly, I appreciate that you guys have spoken very much about the problem of crowded buses and needing to get as much service out as quickly as possible as soon as the factors allow. So, yeah, what are your timeframes or decision-making factors to get to back to a full schedule?
I would say from SMART's perspective that it's a kind of a it's a balancing act. You know, we're really looking at the service we have on the road. We want to try to match it. It's a very exact science, trying to guess where the demand, times, locations are. But, you know, we're having drivers kind of help us with that as well, to, you know, calling into Central, letting us know kind of what our loads are, what times a day, so that in the short and the longer term, as we make our adjustments, we're going to really try to match the service to those locations, which is why, you know, we don't have the commuter routes on at all, because we really don't think there's the demand there. So there's kind of a careful balance. You want to try to get as much service out there. You also want to make sure that you have the resources, the drivers, and the buses to actually have your whole schedule out there all the time. That's kind of why we've stayed at that 60% level. We want to make sure that we have kind of a cushion almost if drivers need to take leave or if we have other challenges. We want to make sure we can guarantee we're going to run that 60% schedule. But also, you know, we don't want to put 100% out on the road if our ridership is still 80% or is still 80% off, because it's, you know, there's a balance there between you really need to have drivers that are going out there if all the buses are empty. So it's finding that sweet spot in the middle. And, you know, even with doubling our service kind of back up to our 60% level of service, we've only seen a small bump in our ridership from maybe 80% reduction, now closer to 70%. But so we're not seeing a spike. If we start to see ridership really go up, obviously that will have kind of an impact on what we do. But we're trying to match the service to stay ahead of the demand, but not to an unnecessary level. So that's kind of our balancing act.
Right. No, I agree. I think we're using the same approach. I have a little bit of I have some other issues that are a little different because I have peaks at certain times that are just off the charts, right? So I have some time frames where our buses are so crowded, even if I was running regular service, it wouldn't be enough service. And I'm trying to figure that out. So we're kind of confused, you know, we're trying to figure this part out. One thing that I noticed after looking at everything, especially looking at what the public has said and all of the documentation, pre-COVID DDOT service needed improvement. I mean, let's call it what it is, right? So yeah, it needed improvement. I got it. I agree. especially looking at the numbers, I was like, whoa, okay, this is interesting. So now I'm challenged with going back to full service, which isn't really satisfactory to some, and then improving that. So I think my challenge is a little different because I have to work on bringing back full service, but the full service needs to be better than the old full service. So it has to be a different kind of service, right? So it'll be full service, but not the same one that you were getting beforehand because you weren't happy with it. So I'm actually trying to attack two birds with one stone. Right now, from a planning standpoint, we're looking at that part. So we're taking this time now to figure out what improvements needed to take place. So when we're at that point, we can go with this type of service, and then everybody will say, wow, not only is service back, but it's better. So really, those are the challenges for me that I'm trying to accomplish. It's a tough one. It's a tough one, but that's what we're going for. So I'm not just settling with going back to our old full service. I'm trying to find a way to improve it at the same time. Because we have the buses. I'm gonna tell you right now, we have the buses, and they're clean. I like saying that because, I mean, I'm cleaning them in the park. They're clean. So we're ready to go. We'll get the driver thing straight. We'll figure this out. And if I could run full service today, I would actually do it. Just for the practice. I'd have the practice going. I have the road soups out there practicing, getting ready for the big day. We just can't do it yet. But just to let you know where my mindset is, if I could, I would. I mean, but from a financial standpoint, you know, I've taken a look at that, and it will be a little bit more. But I mean, at this point, it's a pandemic.
All right. Well, thank you guys for explaining that. Looks like Jamie raised her hand to ask a question. I believe I can invite Jamie to join us. If you would like to unmute, Jamie, you're welcome to ask your question. If we can get.
Okay, here I am. Thank you so much, Megan. My name is, again, Jamie Jr. I represent Detroit People's Platform, Transit Justice Team, as well as I speak for the ADA community. And it's a comment and a question. We at Detroit People's Platform have been getting complaints that individuals with non-visible disabilities have been restricted from entering the front of the bus, even if they have a disabled rider's card and offer to show it. So in our efforts to make sure that every rider gets what they need, the question is to Mr. Oglesby, what steps can be taken or will be taken to ensure that individuals that need to enter the front of the bus are not being discriminated against?
The step that needs to be taken is for you to ask me that question. That's all it needed. I'm glad that you brought that up. You know, I had heard some rumblings of something like that, so I'm glad that I'm hearing it directly from somebody. I need to look into it. If there's if they're still on, is there a time that it happened, or is it something that's reoccurring that a group is saying that's taking place, or so I can kind of figure out how to tackle this one?
Well, I've heard it. We've gotten numerous complaints. Typically, it's near the 42 Loop, which is downtown area. But I suspect that it's probably happening other places, and those are just not constituents that we've reached yet. But I will say that individuals have disabilities that are not necessarily visible to the naked eye. And if a person needs to enter on the front of the bus, they should be able to.
I agree. And let me look into that and find out what's going on. I'm not going to tell you that I have the answer now. But if somebody can get the name and address and or something, or email, we'll get back to you and let you know what's going on there. this is, it's an awkward time because I've had some conversation with some of the drivers from a behavior standpoint. From just today, things are a little different. Things are a little sensitive, but then they're saying, yeah, well, things are different and sensitive for us too. So there's a little testiness going on, and there's some issues that happen that we need to nip in the bud. So let me look into it and see if there's some type of alert that I can put out or something to stop it. Also, I can keep an eye on it. We have cameras on our buses, so I'm interested in talking to staff to see what we can do from that standpoint. That's why I was trying to get a little more information. So if you have any more information that you can provide for me, let me take a look at it. It's something that, though I almost say I'd love to see, but that's not a good thing. But I'm thinking, yeah, no, I really need to see what's going on out there. And if it wasn't the times now, typically I'm always on the bus, I'm riding around, I usually run into some of these things. And in time, that'll happen. We'll get there.
I would be more than happy to provide you with the information you need, as well as speaking on behalf of our transit justice team. We would love to be able actually to partner with you to ensure that post-COVID bus riding experience is a lot better. And we thank you for your dedication to making it better.
Absolutely. Listen, I will take free employment all day, every day. No, thank you very much. I think we really need to work together because, like I said, I want to hear what people have to say, and that's the only way we're going to fix it. So yes, I'd love to work together with you. I've written, if I get your information, whichever way we can get it, I'll make sure that my team gets in touch with you, and maybe we'll have a separate Zoom and we can kind of talk about this a little in more detail.
And I'm happy to help make that connection. Thank you so much, Jamie. If I can ask, Michael, to the extent people have an experience that is not following the way things are supposed to be when they're on the bus, what is the best way to get that information to you? Is it through calling the main phone number? And how are those being handled?
Yes, it's through calling our complaint line, but the way that the complaint line is handled now is a little different because I'm very interested in it, so I ask for everything. So being the new person, it's like, oh, let me see the complaints, and they look at me like, uh-oh. So I actually have been very instrumental in getting involved with some of the complaints because they don't know when I'm going through them. I'm looking for certain things that I'm hearing about. And then B, making sure that my complaints team works directly with operations and anyone else that needs to, that needs to handle items. And then if I already put it out there, if they are kind of at an end road and they're not sure what to do, then it gets bumped up to me. So I've instilled myself in the process because I wanted to learn what's going on in Detroit. So the only way to learn is to get knee deep in it, and I'm in it.
Excellent. As you've probably heard, there have been some people have called in the past, again before your days, but and it felt like it's gone nowhere. Have either waited a long time to get it the line answered, or have felt like the complaint has gone nowhere. So perhaps we should explore ways to marketing effort to communicate that DDOT management really does want to know what's happening up there on the buses, and to call and to communicate that information with you.
I'm going to take your idea if you don't mind. Is that okay?
Please. Okay. Please do. So it looks like we also had Stephen had a question he wanted to ask. I will see if I can bring Stephen on the line. All right, Stephen, would you like to, what's on your mind? Stephen, do we have you? It says he's not muted. Maybe we will give him a moment and we did get a question. Has anyone been in touch? Have either of you been in touch with your colleagues over at the People Mover or at Q-Line as to when they may restart service? No one?
Boy, all of a sudden this thing doesn't work. No. Yeah, I've been, well, actually coming in as bringing me in as the executive director of transit. They put a few things under me. People Mover's one of them. So I have People Mover, Cheaper Mobility, DDOT.
Excellent.
Shot. So I'm basically sitting in the DDOT role because the director of DDOT actually left early and I came in and here I am. And I'm glad because I'm all in it, right? I've been doing this so long. I love it. Okay. So the People Mover, I was on a call when we were talking to the business community about because really the People Mover is about downtown and when things are getting started again. And they're not really sure when things were going to open up. It appeared as if it would have been probably within the next few weeks, but the peak happened again and people got nervous and folks are debating on whether to work from home. So we don't have a set time frame for the People Mover, but I can assure you that because of the way the People Mover is set up, and it, it's called the People Mover, but no people drive it. So we can actually get that going at any time. So the site we're doing the maintenance on it, the corrective maintenance, we're doing everything that needs to happen. And once the businesses start opening up, we can have that going within a couple of days. So we don't have a set date, but I can assure you when the crowds start hitting, you're going to see a move. For two reasons. One, because you're going to call me and say, make it move. That's probably one way. And then the other one is because we're keeping our eye on the prize and we'll make sure it does. The queue line, Robert probably knows more about that than I do.
Yeah, I do not work for the queue line. I know that, similar to People Mover, they've been keeping up. Obviously, rail's kind of a totally different game when it comes to restarting services. So I think that they're similarly, both of those systems do have kind of a redundancy in place. That Smart and DDOT both provide services kind of in those corridors and areas. So I know that's part of their calculation as well. But I don't believe they have a firm date in place either.
Right.
Okay.
And if I can, I was punting that to Robert, but that's not fair. I have been in contact with both because on that call, the queue line was there too, and the queue line's kind of taken the lead of the People Mover. And then when they asked the People Mover, the People Mover folks said, "Well, I'm taking the queue from Michael," and I went, "Oh, really? That's nice." So I will tell you, just stay alert. Watch what we're doing, what DDOT's doing, and when you see, we'll be joint and together when we do the announcement. Everybody will know, and queue line will fall in line also.
Okay. Let's see. Was Stephen able to join us with your question or comment?
Oh, I didn't know I was on.
Okay, Stephen,
Yeah,
what's on your...
But the one question I have with the commuter routes, I've been running into a lot of people that have been saying stuff like, how are you taking the bus during the pandemic? Or I've talked to people who said, oh, I'm driving. Do you have any concern that, I know it's a small amount of ridership, mostly probably choice riders, may drop due to the fear of taking public transit in the pandemic?
Yeah, I'll take that one. So I think that there's definitely, in the short term, I think that is definitely a big role in the response, right? So if you think about if people have another choice, and even the CDC at the federal level, there's been a couple of little tidbits from the state. If you look at some different organizations, there is some guidance out there that kind of discourages people from using transit because of the coronavirus. That is definitely something that's out there. I know, very early on, because I was on a couple of calls with people that I thought knew better, honestly, that said very affirmatively that they were convinced that transit was a primary vector, so to speak, of the transmission of of COVID. There's like really early on, especially when New York and New York City were peaking.
Yeah,
that is definitely out there, and that's why we have the commuter routes are still suspended, because we're hearing that not only are people not working 5-day-a-week schedule, but the whole parking crunch that was in place for Quicken, where they're trying to talk people out of driving down and parking, well, that's not really going to be a problem anymore if they only have a portion of their employees and they're only going down a portion of days. So what we're hearing is that most places are actually kind of back to encouraging people to drive down when they do visit. So yeah, I think that probably for the short and midterm, those routes are still going to see some really low ridership, even as some of our other services and ridership start to come back.
Okay.
That does tie into another question that came up. At one point, the guidance was only ride the bus if it's for essential travel, Chuck said. And he understood that to mean if you don't have to take the bus, don't. To what extent is that still the guidance? To what extent are you still telling people only use it for essential travel? Is there a point at which you think that guidance either did or will shift?
Yeah, from Smart's perspective, we've been following the cue of the state. They're putting a lot of information out about that during the peak of the peak, so to speak. They were really stressing the idea that people should not leave their homes unless it's for something they have to do, supplies, an important medical appointment, or going to an essential job. And I think that that is still, now that we're kind of more of a stay safe order rather than a stay home order, there's still something in there that really says, don't go and ride transit, or don't go and go out just for the sake of going out. If there's a reason you need to go out there and more businesses are open, certainly do it. But don't go and use a seat that could allow people to distance more if you don't have to go out and make that trip. So there's still some validity in that. I think that we're probably not stressing as hard the essential trips only. But at the same time, again, we do want to have people be able to space out as much as possible and make sure that people that need to get to those essential jobs, even though that field is growing as far as how many people are back to work, that the space is there for them.
Agreed. He said it best.
All right. That follows up to another question is that absolutely makes sense in the short term, but do you have any concerns about the long-term impact? Eric asked, with more people possibly working from home permanently and people unnerved by COVID, what's transit's future in the Detroit area and elsewhere? Do you think more people will opt for personal car ownership to avoid transit?
Michael, you want to take that one first?
Yeah. No, I don't think so. I mean, originally I wasn't sure, but the moment that it was announced in the heart of the pandemic, stay at home, my buses were crowded, right? So it's like, it looks like we need to provide transportation. I think that there'll be a slight drop, and if there is a slight drop, it'll be for a certain period of time until people get comfortable again. It's about comfort. It's about what's going on in the world, all of that. But when it's all said and done, I don't think it'll be a major concern. Robert?
Yeah, I think Smart and DDOT really are not pure systems when it comes to kind of some of the functions that we serve overall. We're very similar in many ways, and certainly there's a lot of people that use both systems. I think that probably the message or my response is very similar, that I don't think you're going to see our ridership as a region stay down at 50 or 60% reduction. I think that from Smart's perspective, and as Megan pointed out, this is kind of linked to the last question, we could see a shift for a number of reasons. And even if it's not about specifically people choosing single occupancy vehicles instead of riding transit, it could just be a matter of commuting and to work trip, the whole thing changing, right? If businesses now, I know even at Smart, this is something we had always talked about, like, well, gee, maybe should we offer a work from home option? And this has forced us we have been successful now for 4 months without really skipping a beat of having people work from home. So now even when we come back, that's probably something, not when we come back, when we get back to this new normal, that will now be something that even from Smart's perspective, probably less of our administrative staff will be working 5 days a week at one particular office and using the bus to get there. So I think we may see a shift away from, all this resurgence downtown is really building a lot of ridership there based on all of these people working there. If that changes to less people commuting 5 days a week, that could be maybe a little bit of a negative overall as far as the ridership goes, but really just on a particular type of service. And if you think about some of the other things that are changing here, when there's more businesses that are geared towards package delivery, logistics, light manufacturing. So now looking at, Amazon has different centers that they've built. There's tons of other businesses that I think will have more people working at them that would be, so maybe our ridership shifts from some of our downtown working routes. And now we're focusing more on people getting to some of the more significant kind of light industrial logistics job centers that are farther out that really are going to have more use, prominence, and employment in the future. So I think overall, probably we're going to see a pretty steady, or hopefully we can kind of continue our track of growing ridership, but it may just be a shift from, some of our certain types of services, to others.
Right. No, you're 100% correct. I mean, we have to really start thinking out the box here. We may lose some riders, but gain others. A lot of people aren't thinking about, I haven't heard one question about what are you doing to make sure that you gain new riders to provide transportation, to get on transportation, because realistically, you look at the other side, a lot of people aren't making a lot of money, and, they can take what they can afford. Hey, let me get on this bus. All of a sudden they realize this isn't too bad. I should have been doing this a long time ago. And then boom, you have a rider. I mean, that's how it happens anyway, typically. So we're looking at all of those elements, but there's a lot that goes into that. I'd say, get us back on in a couple of months and ask us the same question, see what we think.
Yeah, that's certainly a challenging question. No one truly knows what's going to happen, but I think you've definitely hit on a couple of the keys. We're also going to an economic recession, and so a lot of people won't be able to afford. It's great to say, if you have a true choice, then some people may choose a car, but there's an awful lot of people who don't have a legitimate choice for physical or financial reasons. And I like what you were saying. You mentioned earlier, Robert, that very early on, people thought that buses and transit might be a major spreader of coronavirus. But I was mentioning to a colleague earlier that in, I believe it was Paris and in Amsterdam, they have done really detailed studies of the how cases of coronavirus have spread, and evaluating over 500 different spreading cases of coronavirus. While they've had very active transit usage, not a single one was linked to transit. There was a similar study in an Asian country as well. So clearly some of the steps that are being taken with the distancing and with the masks and stuff are working. And so hopefully people can start to become a little more comfortable, again, while maintaining distancing. So we are running short on time. I guess I should have known people would have a ton of questions. One question that a couple people seemed interested in, if we can do maybe two more. Mary had noted, I'll reframe what she said. How are SMART and DDOT working together on high ridership routes? She referenced some frustration seeing a SMART bus that won't stop at her stop in the city that runs the same route as DDOT. Can you explain a little bit more where you are coordinating and where you are doing different services?
They must be talking about SMART. We stop everywhere. So go ahead, Robert.
Oh, Robert, we lost your sound.
Sorry, my bad. I think
I got to try that one.
There's a couple different, there's a couple different angles on this that I think are touched by a couple of the questions and comments in there, kind of a short and a long term. In the short term, the service that we're running right now is the only routes that are going into the city at all, with the exception of those that kind of reach into the State Fairgrounds transfer area, are the fast routes. So all of the local service that for the past couple of years has actually gone all the way downtown during the peak routes, the limiteds, which are commuter routes, we have stopped all of that as part of our service restoration. And so we don't have any buses that are going into the city that are passing people by, because they aren't going into the city at all. The only buses are fast buses, and those are stopping only at the fast stops, which are equally spread in the city and in the suburbs. I think in the longer term, there's definitely discussions to be had. We, as part of our Smart Path plan, we kind of looked at this. We didn't make any, there weren't any really strong recommendations about one way or the other, because you can kind of go either way. Having different routes on the same corridor that have different purposes doesn't necessarily mean that you're being inefficient or not coordinating. It's a matter of having, fast and local service, even in SMART's network, are really two different types of services. And so to say, well, it's frustrating because the fast bus passes me by, yes, but the characteristics of fast are what has led to really a boost in ridership overall in those corridors, at least pre-pandemic. So we're always open to working on that, but I think it's important to remember that sometimes it's okay, or even it is advantageous on some of our better transit corridors to actually have some different services that do different things, rather than just saying, hey, every vehicle that goes by should pick everybody up. So again, we're open to it. In the very short term, though, we don't have any buses that are going and not providing service in the city because they aren't going into the city. And FAST is operating the same all the time, no matter what.
Well, I think that's a great answer. So it's really about communication, and we have to figure a way together to let people know what's going on, why, if this happens, maybe a what if this happens, this is why. And at least if you agree or don't agree, you would know that you're not being, if you don't get picked up, it's not because they don't want to pick you up, right? They know that, okay, this is how they lay it out. I'm going to work together with Robert. Since I've been here, I've been talking to Robert, saying we're going to be arm in arm in some of these improvements. I can't do it alone. It's not one side or the other side. We're like one big agency at this point. So I think we have to work together, but then we have to communicate to people that we're working together, and that you can get on either one. And you never know with this, when we go touchless and we figure out what we're going to do with this payment plan and everything else, you never know what could come out of it that's positive. We'll see.
Excellent. Well, we are going to have to wrap up shortly, but any final comments or thoughts, things that we didn't ask that you'd like to share? Michael, maybe you want to start?
No. I mean, this is great. This is a great forum to hear what's going on. And again, we're not saying we're perfect right now, and we're not saying we were perfect before, but we're going to try to strive to get there. This pandemic's really put a monkey wrench in a bunch of things. I mean, there's so many, I have so many great ideas that are put in front of me that I'd love to just run with that I can't. It's so frustrating. And it's mostly by people like, when I do a public session, they say, why don't you just do this? And I go, I like that. I can't do it because it's going to cost X, Y, and Z, but I love that. So I think right now, both Robert and myself, what we have to do is really just use this as a learning tool, and use this time to be creative, to figure out when we're with the new normal. I can't imagine how it's going to be. I just can't imagine. It's either going to be really crazy or really quiet. So we're going to plan for pushing for full service. We want to get there. We want to improve that service, make it a new and improved service, and work with DDOT, work with SMART, and work together, and let's figure out how we can do it together. So that's all I've got to say on that.
Yeah, I would say hopefully people who are tuning into this are kind of getting the feeling that some of the progress that's been made as far as SMART and DDOT working together over the last number of years, with Michael here at the helm, at least it feels like, and hopefully this is kind of what you guys are getting, because this is what we're experiencing when we talk frequently, is that this is going to get bigger and better as far as the collaboration and the coordination. And it is funny that the pandemic really offers the opportunity to really shake things up, because everything is shaken up. And I don't mean, changing to driving on the left side of the road just for the kicks, but when you have something that disrupts all of society so significantly, and you have all these different challenges you're dealing with, I think it really does provide a great opportunity to think about, what are we really trying to do here? Are there things that we could adjust to make what we are able to do even better? Since we're already making a lot of other, changes and adjustments to this new normal, kind of everyone's going to be learning how to live once we kind of get past this. It's never going to be the same. So this is a good a time as any to really make sure that what we're doing is kind of, state of the art, 21st century, something that really matches the conditions that are out there in all of our communities. So looking forward to it.
Excellent. And there are still a couple of questions we didn't get to. If it would be all right, I would love to capture some of these additional questions, email them to your teams. Do you think if you guys might be able to get back to us with a few more answers that we weren't able to get into in terms of extending routes into more places, impacts moving forward. I very much want to certainly thank our panelists and thank everyone who has been participating. I do have a quick poll I would like to ask, see if you have any thoughts as to how this event went. What did you learn? How much did you enjoy it? And True is looking to do a series of virtual town halls like this to delve into different topics, bringing experts and issue experts together with personal experience experts and personal voices. So please let me know what some of the topics are that you might be interested in. If they're not on the list there, definitely put them in the chat or email them to info@Detroit Transit. Again, if there were any questions that we hadn't had a chance to get to, you can email them to me at info@Detroit Transit. Put them in the chat. We're going to capture all of those. The next virtual town hall, transit town hall, is going to be on August 12th. We are going to partner with the Sierra Club to look at the role of transportation in climate change and how can public transit be an important factor in decreasing climate pollution. So tying into some of those last questions that we were talking about, we definitely need to make sure people are getting back on the bus. So just a few final thoughts. As I said, True is working on a preliminary, we drafted a preliminary report. We're going to be capturing some of what's been shared today and putting that out over the next week or two. So please do share, or in the next couple weeks, give us a little time, and we will certainly share that with everyone. If you are not already on our email list, please put your email into the chat. You can send it directly to us if you don't want to send it to everyone, and we can make sure that you get a copy of that report when that does come out. We've got a lot of exciting things that are coming up. We're exploring developing a safe rider guide for employers as people are starting to come back. How can we incorporate some of this great input that has been shared? And sorry, double checking my notes to see whatever else. So it sounds like we've gotten some good input here. I'm glad people learned a lot, or learned a good amount from the event and enjoyed it a lot. And it sounds like we've got a lot of topics that would be very interesting to explore. So certainly keep in mind, make sure that we have your contact information so we can stay in touch and let you know about future events and future opportunities, both to work with the leaders here on some of the great ideas that were explored, ways to improve communications, get more rider voices involved. So thank you again, everyone, and I hope everyone has a wonderful evening and stay safe out there riding.
Very good. Thank you. Thanks for having us.
Thank you.